I'm Dr. Barry, licensed psychologist, and here we talk about true crime and psychology. Thank you so much for joining. Let's hop right into today's topic. Let's go. Welcome. Today, we are going to just do an overview of the mental health testimony that stood out to me in week 4 of the Lindsay Clancy case. It is Tuesday, so I'll be covering Monday and Tuesday, and I will have a follow up video on Sunday. If for some reason the defense rests, but I feel like the defense might be getting close to the end of their case, and then the state is going to have a rebuttal case. And this, but so I don't know this for sure, but I'm just gauging it based on some other cases. It seems like this could go to the jury before the end of the week, but we'll see. We will see. Welcome. Thank you for joining live. And thank you all for asking questions. Lizzie, I see your question with the QQQ. Please make sure to put question marks or 3 Qs. That just helps me see everything sooner. Let me know if y'all have general questions, and it can be any question related to this case because I am fully caught up. I did a video earlier today covering week 3 because I missed Dr. Tuff's cross-examination while I was on a cruise. Poor me, I know. I'm in the Bahamas but we had a great cruise. I'll be talking about that on my second channel, but we are live. So we are live right now. Are we Oh, the surrogate situation? I'm not sure. I've heard of a few different situations like that. I haven't talked about that particular case, if that is related to a different case. All right. All right. So, Lizzie, thank you for the question. All right. So let's look at Lizzie's questions first. What do you think of Dr. Zeisel essentially letting Lindsay cold call Patrick? I find that unfair to him. No care taken to prearrange a time where he can be in a safe environment to protect his own mental health. Suddenly picking up the phone and it's her. I'm adding some information. When he hasn't spoken to her since the event, I can't imagine how traumatic that must be, even if the doctor had spoken to him first and asked if he was willing to talk to her. Sorry, that just troubles me. And so Patrick might have wanted to talk to her. I don't know. So I don't know how that was from Patrick's side. I don't I don't know. Um uh yeah, great question. I really don't know. And I think that doctor was focusing on what Lindsay needed in that moment versus how it might affect the other person. And I remember in the what case? It was out of California. What was her name? She was I think one of the psychologists determined she was kind of a sociopath. Jodi Arias. I remember the psychologist that evaluated her by the defense, like he gave her this book and he seemed to become just like really entrenched in her mental, like it didn't seem like it was a neutral evaluation. It seemed like the person was also just very invested in their mental health. Now I think Dr. Zeisel is giving his expert opinion as somebody that treated her, but it sounds like he kind of counseled her as well. I'm kind of confused. I think it's going to come up with the state when the state kind of comes back to ask him questions, because it did slip out that Dr. Zeisel has been like concerned about Lindsay's mental health during these proceedings, but she could be receiving mental health support through the jail. Now, she likely has some form of trust with him, but if I was the evaluator, if I was the forensic evaluator that was testifying in somebody's NGRI case, I wouldn't do additional sessions with them during the current trial. I personally wouldn't do that because it could become an issue with the court, anything that that person says related to those hearings, because when somebody is saying not guilty by reason of insanity, their mental health is like wide open. anything they do or say becomes wide open. I do agree with the judge. I don't think the state should have had access to Lindsay's meetings with her priest or any information about her meeting with the priest. That is her religious um well-being, her spiritual well-being. I'm glad that the judge shut that down, and that the judge also shut down the state's question when Patrick's mom was on the stand, and the state was almost when they tried to bring up that religious question. I was glad that the judge shut that down. I wanted to start with Lindsay's friend. So on Monday, yesterday, Lindsay's friend testified that I think they worked together. So it was friend, but I think they worked together. But she mentioned that Lindsay would cry after strangers had had a baby due to it being a beautiful moment. The friend described Lindsay as a very detailed person, often asking for childcare and parenting tips. And the friend also mentioned that Lindsay never let Cora cry and called the police in the middle of the night because she couldn't get a hold of her husband. I think Cora was crying and Lindsay couldn't get a hold of her husband. And I think that's where the state is trying to paint her as this overly anxious, overly cautious person. But I think she was just doing a no cry method, and she was just very now I wouldn't have called the police if my now something if my child was in danger, that would be something different. But the state is trying to present things in a certain way. And the state and the defense, they're looking at the exact same results and seeing something completely different. Yeah, like now y'all know my mom is sometimes in the chat, and I used to message her for proof of life. She watched our son for the first 18 months of his life, and so from about six weeks to 18 months. And I would sometimes text her POF or POL, a POL. I need proof of life. And so I would text that to her, and we joked that she had 30 minutes to text me back. Now, if she took an hour or 2 hours, if she took longer to text me back, I wouldn't have called the police. With anxiety, you have to be careful because anxiety wants certainty and control. And sometimes embracing uncertainty, embracing not knowing, embracing that it'll be okay, But I think Lindsay was trying to follow this like strict attachment parenting because I think she desperately, and this is just my thoughts, I don't know this for sure, but it seems like she didn't want to mess up or ruin her children. And sometimes people can take that to an extreme where they're trying to be perfect parents, and that doesn't exist. That there's going to be a point where you're trying to take a shower, the baby's crying, and you might just need to finish that shower, and your child cries for like a minute. Now, that's different than me allowing my child to cry for hours upon hours. That's different, because in order for a child to learn how to self-soothe, sometimes you let them cry for short periods of time. So, I did do the no cry method combined with a few other sleep training techniques. My kiddo did not sleep well the first year. I also did not sleep very well the first year because I did nurse him for that first year, and the thing that could get him to go back to sleep was a little bit of milk. And I had what could help him go back to sleep, and so sure enough, I would nurse him back to sleep. The doctor would, I don't know, like the doctor could have said whatever he wanted. Nope, my baby's been crying for more than 50 because I would time it. So when he would start crying, once he got to a certain age, because now under the age of 3 months, but because I don't even try to sleep train, but once he got to a certain age, I did because so we did things like helping him learn how to self-soothe, all of those things. That was hard. That was hard. Now, once I stopped nursing, it was like a rough night or two, and I would hold him, I would be with him while he was crying for periods of time, but eventually he slept through the night and everything was fine. I slept better when he wasn't in the room with us. So, I had one of those like Halo. It was I'm not endorsed or but that's the brand of bassinet that we had. And, so getting sleep was difficult. So I could really relate to Lindsay talking about just, like, how she just wanted sleep, and I only had 1, and so Lindsay had 3, but, with my child, getting sleep for myself and for him that first year was very difficult. I think at my child's, like, 1-month checkup or something, the doctor asked me like, give me one word to describe your child." And I said, "Nocturnal," 'cause I was so tired. And the doctor was just like, "What do you do?" 'Cause he wondered if I was in, like, healthcare or something. Yes. I was like, "He's up all night. He sleeps during the day." But he was 1 month old, and that's what they're supposed to do. Because even when I was pregnant, he would sleep during the day, and then he would kick me from about my last maybe 4 to 6 weeks. Sleep was already starting to get difficult. I'm just sharing all of this because if there are any parents on the jury, they might be able to relate to wanting to sleep, to wanting to do things, you know, in a certain way. And the state is making it sound like it is completely irrational and uncalled for a parent to not want their child to cry, or I don't know, like, so the state is taking this perspective that might be taking it the wrong way. I was so tired. One word, nocturnal. Yes. Ah. Um, and I did mention that my pediatrician did screen me for I think it was, like, for the first 6 months or so, whenever we would meet might have been almost all the way up to a year, but the pediatrician would give me a screening, for me to complete about any of my symptoms, and I think if I had flagged anything on the screening, then, I think that would have raised something higher. Relentless. I love that. Sleep deprivation definitely can cause psychosis. A lack of sleep really can cause difficulty, and I think that's why but I think the state is alluding that maybe the sleep wasn't that bad, like this but because 'cause they're finding these 1 or 2 messages where Lindsay said that she was sleeping, and so I don't this is a very difficult case. I am still in the middle. So even with hearing some of the defense experts today, and I'll get into some of my thoughts on that in just a moment. I'm still I I think this is a very difficult case. It's complicated, it's complex, and I think the state, because I think at the very beginning they said that they're not wanting this to be a case about, postpartum depression or postpartum psychosis in general. It's hard for it to not generalize that way because even in local mental health groups that I'm in, so I'm in different Facebook mental health with other mental health professionals, and there are these warnings being posted of like, be careful what you advertise yourself being like on your website. Like, don't say that you specialize in treating this and you really don't. So when I say I specialize in treating trauma and working with adoption, I have certifications that I've done that back up that statement. Now, I am now EMDR certified. Before I would not even dare say that I did, EMDR or anything like that. If one of my clients was looking for that service, I would help them connect with somebody that could offer it. All right. And so I'm gonna scroll up to see the question. I am flagging questions. Please make sure to put QQQ or question marks. Yeah, so Red Bun, I have your question flagged. Okay, so please know. I'm gonna get through some of the content first, and then I'm gonna go back and answer questions as I flag them and they come in. Okay. So Lindsay's friend also talked about Lindsay working with a patient that had plans to harm herself while the patient was pregnant, And they also talked about the Andrea Yates case, and that Lindsay cried and said, "How could a mother hurt her children?" I don't know what the jury is going to do with that information. I think the defense wanted that to come out, meaning that there was a point in Lindsay's life where she never so like what happened was out of her norm, and that wasn't her. I think that's what the state, what the defense is trying to get at. Thank you so much, Afton, for gifting a membership. Congrats to whoever gets that. All right. And so Lindsay's sister testified, and that Lindsay had talked about having serious thoughts toward herself for every day for about a month. Lindsay's mother also testified that growing up, she had no issues with discipline or breaking the law. She was at some point during this mental health crisis that Lindsay was scared and not wanting to be alone, and that the mother stayed with her for a period of time. The state, because the mother, Lindsay's mother, initially said it was a week, but it turns out it was likely less than a week based on some messages, and that Lindsay asked her mother to sleep and like to sleep in the same bed with her mother for one night in either late November or early December, just because she was feeling, I think seemed like she was feeling unsafe, or just like she just wanted to, like that's mom, and she wanted to be next to her. The mother talked about Lindsay losing weight, becoming paranoid, that this wasn't her mind. This isn't me. I've never been like this before. She was attempting to go through the motions. She didn't want to drive at one point. She was concerned that people would know that something was going on. The defense attorney, the defense lawyer is going to try to turn that into Lindsay thought other people could hear her thoughts. And I don't know, because I didn't hear it that same way. So some of the things, so the state has been leading, and like both the state and the defense, I haven't loved all of the lawyering. Like, I'm just being honest. I'm being honest. Like, sometimes the way that both the defense and state are asking questions, I'm just like, huh, like it's because there's a lot of leading. It is what it is. But Lindsay's mom talked about that Lindsay was concerned that the people at school would know something was going on. She was struggling, saying that this wasn't her. And let me turn my do not disturb on. There we go. For an hour. There we go. So hopefully, if y'all heard that alert, hopefully you won't hear anymore. And let me see. Her mother also talked about that Lindsay just wanted to feel better and enjoy her kids again. The mother also noted that Lindsay complained of memory issues, and that's where I wondered if she was tracking her side effects and what she was doing, because she was having difficulty remembering. But also, she was a nurse, and so it almost seemed like she was charting her own symptoms the way that like a nurse might do. That's just my outside looking in observer's point of view. And Lindsay's mother also said that Lindsay was nervous and said that she had thoughts of harming the children. And this was back in December. And that's where, because the mother said thoughts, Lindsay was having thoughts of doing this. And that's where I wonder if that will play into the state's case of, is this intrusive thoughts or was this an auditory voice? And then also, if she can not share information with the doctor, understanding, being concerned about losing her license or being concerned about losing the children, but if she is experiencing these voices and she's not telling somebody, I think that's where the state may think that she did understand that what she was doing was wrong. I think the defense expert is going to say that nope, she came in and out of psychosis. She had intermittent, periods where she was out of psychosis or she was in psychosis. And that is possible. So it is possible for a person to, kind of come in and out, like hearing voices and then not hearing voices, experiencing symptoms of psychosis and not. But some of the testimony, I just wondered if the mom making that statement, if that could hurt Lindsay's case at all. Now, I don't think her mother intended to do anything, but like me just listening, when she said that, I was like, ugh. like, because her mother said thoughts, but that's what Patrick said thoughts. Everybody has said that, and that's what Lindsay told them. And now, after meeting with Dr. Zeisel after the incident, Lindsay said at some point that it was a voice. And I'd be interested because we haven't pinned down when that voice started and when she started experiencing psychosis. Um, some of the testimony today was very vague. I'm gonna get to Dr. Zeisel in a moment, but some of this has just been a lot. Both sides have just the lawyering has been I haven't been as big of a fan. Now, there are other cases where I really appreciated the approach the state had. I really appreciated the approach that the defense had. In this case, it's been painful at times. Then Susan Clancy, Patrick's mother, testified that Lindsay and that's where I wondered because Lindsay was saying one thing to family and friends and then not according to the records. And the doctors could have left. I don't but normally if somebody is complaining of something serious, you're going to write that down. So when I have a client that is talking about certain things, I always write that down. So the things that Lindsay was telling her family and friends those weren't that wasn't what was being communicated to the doctor fully from my perspective having heard the doctors testify um and that's where Lindsay could have been afraid of if she reported certain symptoms would it affect her nursing degree, could it affect her ability to be around the children or have the children and, um, but yeah, it's a lot. And then the state bringing up, that within the Catholic Church, and the judge quickly cut that off, and I was glad that he did. Then there was a defense okay, this one was fine. Dr. Condi is a psychiatrist that did not meet with Lindsay, but reviewed all of the records, and we were able to clarify. So when I went live earlier, somebody said that $34,000 medication that they denied that, and it was an infusion. So it was some type of 60-hour infusion. Excuse me. And the medication cost, it's Zurestol, that's how I wrote it down, something like that. That was the medication that was denied. On cross-examination, the expert wasn't aware of some of the information. So this expert had been retained for the civil lawsuit and was brought into the criminal case. So the state really pressed, oh, there are only 7 pills missing from the Zoloft or the Prozac. I forget which one, but that there were, and so the state was alluding to the fact that Lindsay never took the double dose. Um, uh, and he really couldn't speak to that because he wasn't aware. And that's where he did mention that Lindsay could have been worried about losing her nursing license or CPS being contacted. Then there was another doctor that was testifying about Lindsay's injuries, and I think trying to say that Lindsay had fallen on the top of her head. I guess trying to say that she like went out head first or like that she hit her head on the icy ground. And but she didn't evaluate Lindsay. She was just so stern and or like so just steadfast on yes, Lindsay definitely hit the top of her head and not some other way. In a way that to me made her testimony a little less credible. I don't know what the jury will think. But for me, because as an expert, you have to sometimes admit that yeah, it could have happened a different way. Could she have hit? Could this injury still happen from this way? Could have. My opinion is still, I believe that this is how it happened, but experts sometimes do need to say that yes, something else is possible. The state also brought up, I guess that expert had testified about somebody dying this way. So if you're listening, I apologize. I put my hands around my neck because and Lindsay was really tearful during that part of the expert's testimony. The camera specifically panned over to her, and I don't know, I couldn't see tears because you can only see the side of her, but she was, it appeared as though she was getting emotional during that part because the expert, and this was the defense expert that's just going into details asked by the state and the defense, and they're getting into the specifics of how the children might have passed. Like, was it 5 seconds? Was it 10 seconds? Was it 20 seconds? Because the state is trying to say that Lindsay was holding the bands the entire time. This expert seemed to opine that the bands could have been tied and then that it just happened on its own. I'm surprised the state didn't ask, like, wouldn't a 5-year-old, like an older child, would have, now I'm not like, you would think an older child would be able to try to get that off, that there would be some, like, that there would, that an older child would kind of try to fight that. But that was, I wasn't sure how much that expert helped. Y'all can let me know in the chat if y'all thought that expert was particularly helpful. I didn't think it was. Um so then Dr. Zeisel. So we get into the MMPI, okay? And I forgot that the MMPI was normed on a group of rural married white men. Like, I forgot. Now, I think they've updated their norms, they've expanded things, but there does still tend to be some cultural bias. So African Americans can tend to elevate certain scales on the MMPI. They've done research. There is, research related to cultural bias within psychological testing. And I don't give the MMPI, I give the PAI, the personality assessment inventory. I hate that the MMPI, it's either true or false. I absolutely hate that. I'm not a dichotomist because you either have to say it's true or it's false. Like, you don't have any other options. And it's like 500 questions. Clients already like look at me like I have two heads when I give them 300 to 400 questions. I think the MMPI, I think it's over like 500 true or false questions. And I took it 2 or 3 times in graduate school. We had to take the test ourselves in order, because our classmates would practice writing reports and we would practice taking the test and everything. I was not a fan of that one. I like the personality assessment inventory better. But we get into his, a lot of people went to Harvard. There's a lot of Harvard people. Um, he considered, oh, and he didn't give the MMPI. So there's a Dr. Helbram. So I think that's the state's expert, and that individual gave the MMPI. And I'm guessing that Lindsay didn't elevate the the exaggeration or the validity scales. I'm guessing that she gave a valid performance or like valid, answers to that test, because that test tries to see if somebody is over reporting symptoms. Are they under reporting symptoms? Is it a fake good? Is it a fake bad? That's what that test tries to get at. The attorney was concerned about Lindsay's mental health, and he's the one that called this expert to visit her. And this psychologist went to the surgical unit to meet with her. And he went on to say that she remembered what happened, but it was fuzzy and foggy. She said that she had had no contact with her husband and wanted to know how he was doing and if she could call him and see where things were with their relationship. And during this talk, it came out that Lindsay said that she heard a male voice ordering her, telling her that she didn't have any choice, that she had to do this to the children and herself. He checked in on Lindsay while she was in lockup during the trial. They talked about the medication she was on during nursing school, and I think he said her medication wrong, because to me, what I heard, he said that she was on Zoloft, but I believe it was Prozac. And it's people, but he I think he did say Zoloft, and I believe it was Prozac based on my notes for this case. And once I wrote down, I don't like the lawyering. The defense asked a question, and the defense told him the answer is yes. Like, the defense said the answer is yes. Did she? And he went on to ask the question, and I was just like, are we allowed to do that? Like, is that, can you? Can a lawyer do that? I'm so confused. I guess a lawyer can. And that's where the psychologist went on to talk about that she was having intrusive thoughts and dark thoughts, horrible thoughts, that she thought other people could hear her thoughts. And that's where I hadn't heard testimony about her thinking other people could hear her thoughts. Like that was very specific. And I hadn't heard other things. So I don't know if this is coming from his interview with her. I was a little confused about that. This part, it was very vague. And I need some more specifics. I think the state is going to cross-examine this witness, of course. And and that's when he talked about the intermittent psychosis. Okay, let me get to y'all's questions. All right, I answered that one here. I watched a video earlier with a psychiatrist, saying he thinks psychosis was. Yes. Do you think it's possible, since there seems to be rational planning and not acting? So there can be, even if it's not drug induced psychosis, a person can exhibit certain signs and not look completely disheveled. So there are different, I say, levels of psychosis. So there's some people that just hear an auditory voice. There's some people that hear command auditory hallucinations. Normally, psychosis within a diagnosis like schizophrenia, it's going to present a certain way. Psychosis during mania could be, delusions of like somebody thinking they can fly or something like that. Psychosis during major depression. So all these things can present different. And so we'll see. Anything's possible. But yes. All right. Let me know if y'all have any questions. Um, this case is a very, very tough one. Please make sure to take care of your mental health while you are watching. I just saw a question that I missed. Here we go. Would it be possible for Lindsay's family to have her committed, as the state asked her mother or sister? Yes. So if the family was concerned about her mental health, they could have, against her will, requested a evaluation. I forget what it's called in Massachusetts. I know in Florida it's called Baker Act. In Virginia, it's an emergency detainment order, or a temporary detainment order, or an emergency detainment order, where a person goes before a judge and the judge decides whether they're hospitalized or not. But they're normally in the hospital for like 48 to 72 hours before they have that hearing, because the hospital staff often also, participates in that. They normally have to be assessed at an ER, and they have to meet criteria for hospitalization. So somebody um, can be recommended for hospitalization and not meet the criteria. Can you please explain why you thought the mother's testimony might have made the opposite argument of their intent? So thoughts are different than a voice. So somebody having intrusive thoughts, because those thoughts are coming from within, or like intrusive thoughts, but an auditory voice would be something different. Um, and what Lindsay might be saying is that she was concerned about how other people might think about what they might think about her, but um, I haven't heard any testimony that she was reporting auditory hallucinations. So she was reporting dark thoughts, intrusive thoughts. I haven't heard testimony that she reported auditory hallucinations prior to meeting with Dr. Zeisel. Does that mean that she wasn't having them? I'm not saying that. I'm just saying that the mother's testimony about there being dark thoughts, intrusive thoughts in December, that's different from psychosis, because she was telling her prescribers that she wasn't hearing voices. Um and she and so that's where we don't know. This is a very, very difficult case. Doo-doo-doo. Can you tell me how? Okay. So, mental health is very difficult. And um, in Virginia, a senator's son was evaluated at, let me see if I can find his name. Doo-doo-doo. Because they ended up passing a law. Um, and because the senator's son was evaluated at the emergency room and then ended up, harming his I believe his mother. And so there's one in West Virginia. So there's definitely, and I think this individual was convicted. I don't think so. That was after mental health evaluation. After mental health. I'm bad with names. I feel like it was in Deeds. Yes, it was Austin Gus Deeds. Um, the senator's name is Cray Deeds, and but not his mother. It didn't. He actually it was his father. He harmed his father before harming himself. And this happened about 13 hours after he had undergone an emergency mental health evaluation, but was released not because he was stable, but because they couldn't find a bed. So he wasn't released because he was okay to go home. So there are times in Virginia where there is a lack of availability of a bed. And so I'm in Fredericksburg, Virginia. And Virginia Beach is about 2.5 hours, maybe almost 3 hours. Somebody in Fredericksburg could be hospitalized in Virginia Beach, just if that's where the available bed is. But there are beds right in Fredericksburg, but there are times that there are no beds available. And there are two mental health hospitals in in Fredericksburg that accept beds. And so there are certain periods of time where there are zero adult beds. And so now we have tracking for available beds where hospitals, I think they can better communicate when they have availability, when they don't. Sometimes a person will remain in the emergency room for 2 days, but there's a point where they have to send the person home. And that's even if, yes, they are a risk to themselves or somebody else. And what they say is like, hey, if something happens, bring them back to the emergency room. And that's literally what happens. And so I believe after the death um, of Senator Deed's son, I do believe that Virginia passed, that laws were passed to help improve mental health and the available beds. Acute hospitalization, so that's short term, they're normally just gonna throw meds at it. Does that make sense? So sometimes more is needed than just medication. So in Virginia, there is a state hospital where sometimes if people need long-term stabilization, and there are probably even less beds there. But there's also intensive outpatient. There are multiple programs available. It is very difficult to find care. I heard that she tried to get help and was turned away. Yes, but that was from one program. That was from the Mothers and Infants program, I thought. And they thought that she would do better with something that focused more on the medication because Patrick and Lindsay were reporting that some of her symptoms, I don't know, that she was over medicated. I don't know. But that's because this has been what the state has said, what the defense has said. And like I said earlier, I think the truth is likely somewhere in the middle. That women's and infants, I think they didn't think they would be the right fit for her needs because I think they were concerned about her medication. All right. All right. And so please make sure that you drink your water, that you take breaks when you need them. This is a very heavy trial. There's some testimony that I have not listened to just because it's just for my own mental health. Okay. Um, my heart breaks. I do think Lindsay was desperately trying to get help. It is common for sometimes for people to not be completely forthright with their providers, where maybe they are having more serious thoughts and they're scared to share or talk about it. Sometimes asking the provider, like, what's your policy if somebody is, if you are concerned about safety? So I know for my office, my policy is that we try to do the least restrictive method possible. And I try to collaborate with the family. If we are monitoring ongoing safety, I often try to get in-person sessions if at all possible. And with new mothers, I love when they bring their babies with them. There's just something, and I tell them I get distracted by babies. So, like, I'll be in the session, like, trying to, like I get distracted by babies. Other people's children are absolutely amazing. I did not love the baby phase, so I like it when they can, like, walk, talk. If they want a snack, they can go and grab it. Like, I like the older stages. Some people love the baby phase, so I like making faces at other people's babies, but, like, I didn't love the baby phase. And that it doesn't make me a bad mom to say that. Like, it's like, I didn't that wasn't my favorite part. Um, uh, uh, that first year was tough, was extremely tough. And, yes. All right. So, I wish that some of the doctors had said that, like, maybe I could have ordered, but I think they didn't. I don't know, because they also have pending civil litigation as well. So that might have influenced some of the way that they testified. Because to me, as a psychologist, if I have a client that's struggling with postpartum depression, so they're getting therapy. I often recommend that they talk to their primary care physician, because normally it's the primary care physician that runs the labs. The psychiatrist normally doesn't run the labs unless they're on something uh, like lithium or Abilify or something like that. But normally lithium is the one where we normally want to get blood levels checked every so often. But I normally send them to their primary care doctor to get labs run, and then that they consult with their OB as well, because sometimes there can be hormones that haven't stabilized. And so if we don't get anything else from this, it's, medicine. One particular thing won't do everything. Taking a holistic approach. I'm gonna have to price what those drug tests. So there's a test you can take that, based on your genetics, it might recommend, okay, if you have to be on an SSRI, this is the type that might be helpful for you. Sometimes those are covered by insurance, sometimes they're not. There is something called treatment resistant depression, and that's where someone has tried 4 different, um, antidepressants and or like something to stabilize mood or depression, and they're still not doing well. And there's something called TMS, transmagnetic stimulation. Yes, I believe that's it. Transmagnetic stimulation, and it's just this like magnet that helps rewire the brain. I haven't had any active clients do that. I've had some people need clearance to be able to receive that type of treatment. And so just knowing that there are lots of options, lots of things out there. And then in an earlier video, we talked about if someone in your life is struggling with their mental health, making sure that we don't, um, it's called that we don't, like, try to make them feel better too soon. Does that make sense? Sometimes sitting with somebody in the midst of their pain, letting them know, "Hey, it's okay to cry." Vulnerability breeds connection. When we can connect with others with where they really are. When I go visit a new mom, I'm always asking, like, "What can I do?" Like, don't wash dishes, don't do laundry, don't do anything before I come. I just wanna see you. I wanna wave at the baby, and then, like, I'll wash some clothes. I'll, let you go take a nap. Like, what do you need from me? And if you don't tell me something, I'm just gonna start doing stuff as long as it's okay. Like, "Hey, is it okay if I," and I'm not judging you. That these things, aren't done. I'm trying to support, I'm trying to help. And so, I it's hard. With vulnerability, the person whose work I really like on that, it's Brené Brown. She has a lot of great resources. It's difficult to be vulnerable. We often have to attack shame. So shame is I'm wrong. So every parent feels guilt at some point, but sometimes somebody can like be paralyzed by shame and feel like there's something wrong with me. Why can't I get this right? What did I do? And now some but like if it's just these normal parenting things, now I might feel guilty that, yeah, I can't give my 3rd child the same things I gave my first, but I've also learned things along the way. The first baby is the practice baby. Okay. The first baby, like, like I don't know what I'm doing. By the second baby, okay, I've kind of figured some things out. I know by baby number 3, 4, 5, you know what I mean? Like, but the baby number one, that's definitely practice baby. Do you think Lindsay Clancy would let you do that? I don't know that she wanted to be seen as struggling. Now, I don't know that to be true, but based on the way that her friends described her, based on the way that everything seemed, it seemed like she wanted to be perfect. I personally wondered about, like, anxiety and, like, OCD type stuff because with obsessive compulsive disorder, there can be intrusive thoughts. There can be this need for perfection. There can also be obsessive compulsive personality traits, but normally that would have started to present earlier on before children. But I don't know enough about her history to kind of, so just in general, my brain has thought about like, I know they're saying bipolar. I know they're saying postpartum psychosis. My brain just starts wondering about other things too. I'm intrigued to hear from the rest of the testimony of Dr. Zeisel. I like his name, Zeisel. It's a great name. And then also hearing from the state's rebuttal experts as well. If they are talking about intrusive thoughts, is it okay to ask if they're hearing voices? And so that's where sometimes I will clarify with somebody what does like, especially if it's over a period of time, but normally the way that a person describes intrusive thoughts is different from how they describe psychosis. Um, because they would be describing that like there's I'm hearing somebody and nobody's there. Like I'm hearing something and I turn around and nobody's there. And it's often very distressing to a person unless they're in the throes of like a prodromal schizophrenia type disconnection from reality. Um so yeah, that's my general answer about that. All right. All right. The middle child gets now the middle child is gonna feel like they don't get enough attention because the middle child, there's definitely some middle child syndrome stuff that definitely does occur. There are some things that we can know about birth order. The oldest child does not in every case, in every family, but there normally is a lot of pressure and sometimes the oldest child tends to be the most responsible. Um, and this doesn't always happen, but sometimes the youngest child can be, the one that tends to be a little bit more spoiled. The middle child can sometimes feel like the lost child if they're not like the identified. Because sometimes there can be these dysfunctional family roles where somebody falls into like I'm the problem, and the only way they get attention is if there's something going on with them. But yeah, um, yeah. And then so I thought it was interesting that her mother was a Weight Watchers, like something with Weight Watchers, because I just personally wondered about like healthy views with like food and self and um I just wondered about some of those things. Just in general. Does it mean anything to if people just quietly talk to themselves? Hopefully not. I do it all the time. So I am neurodivergent, and so sometimes my internal voice comes out. So, especially for people that are neurodivergent, sometimes when they're talking to themselves, they're just working it out. If there's the old D.L. Hughley. I think it was D.L. Hughley. There's a comedian back in the day, like the 2000s, that talked about talking to yourself, just working it out. So if you ever run into me at the grocery store, I will be sometimes just like, "Ah, what did I need?" Like I will have conversations with myself, but I don't answer myself. I'm not having a full-blown conversation back and forth. It's a one way. I'm thinking out loud. My internal voice comes out. The pressure to be perfect can be a lot. And sometimes that can happen within like those Facebook groups. So you have to be careful with the mom Facebook groups. Because sometimes they'll be like, if you don't breastfeed your child for the first year, your child is never going to love you. It's like, what? Like, that's no, like just feed the baby. Like, don't. So like sometimes people will be like, if you let your child cry, you're a horrible mother, or like, this is the only way to, no, every child is different. Every parent is different. I joked that my child is not a book baby. There was no one method or no one thing that worked for my child. And I specialize in treating children and teens, but I started age 6. I didn't, oh, 3. The age of 3, that was the absolute hardest phase, absolute hardest. Some people also struggle as their children want to be their own people. And so I embrace that. So, you all know we got back from a Disney cruise. My child wore nothing Disney. And I am like a Disney fan. Ooh, I have a new thing. Let me see. I have a new Tumblr. Let me see if I will. No. I didn't get this for my child. I got this for me. I was super happy with it. So my kid's favorite thing about the cruise was just looking at the ocean. We could have done that on Royal Caribbean, but he had a great time. We had a great time. Um, but like I didn't force him to wear like matching shirts. Nope. I did sometimes say like, "Hey, we're going to dinner. You have to wear a fancy shirt." And a fancy shirt is just like a button-up polo. Like it's like a nice it's not suspenders or suit or tux. It's none of that. It's just not a t-shirt. It's just a polo shirt. And so, yeah. All right. Let me see. Um, is there a psychological name for somebody who presents really quiet but have a way of getting everyone to attend to them? I'm not sure. Olaf is awesome. I got a picture with him too. So I'm going to be going live on my second channel and I might share some pictures. We'll see. We'll see if I share some pictures. Olaf made a special so oh well, I won't mention it here because maybe it's a surprise. Yes, I have Doug. I have Doug and a squirrel. Doug. So Doug and I have a picture in the parks that I got of Doug. And then so Up is one of my favorite movies. When we were walking through the ship, my kid asked me about Bambi, and my kid doesn't mind like if you spoil things. So I was like, "Yeah, it's a movie." I was like, "But like there's some sad things, there's some sad parts." Disney has a way of like offing parents. Like that's just what Disney does. Um, I absolutely adore Olaf, and it's mine. It's not his. I bought a Figment popcorn bucket for me. Like I kind of said it was for him, but I really wanted it. He's since taken it back, and it's fine. Yeah, Bambi. That's a you have to prepare people. Like, hey, we're gonna watch this movie. It's gonna get a little sad. But, I appreciate you all. Thank you all so much for watching. If there's a verdict before Saturday, like, if it's Friday, I'll probably just wait until Saturday. If there's a verdict earlier, I might do a short. I will probably wrap things up because I wanna talk about the rest of the mental health experts. So, because I think this case brings up some very important points and some very important things. And my heart goes out to the families. I intentionally didn't put like on my thumbnail, I didn't use the parents, and I'm just kind of like Lindsay is the person that I'm using on the thumbnails or the professionals. But my heart just truly does go out to the family. I so appreciate you all. Be kind, don't do crimes, and I will see you all next time. Have a good Bye.